Before beginning, here is some important safety information about Berinert. Berinert C1 esterase inhibitor (human) is for the treatment of ongoing acute attacks of hereditary angioedema (HAE) affecting the abdomen, face or throat in adults and adolescents. The safety and efficacy of Berinert in preventing HAE attacks have not been established. Do not use Berinert if you have experienced life-threatening allergic reactions or severe hypersensitivity to the product. Immediately report to your physician or an emergency department any signs or symptoms of allergic reactions to Berinert, including hives, chest tightness, wheezing, turning blue, fast heartbeat, and shock. Also report signs and symptoms of thrombosis that occur after infusing, including swelling and pain in the limbs or abdomen, chest pain, shortness of breath, loss of sensation or motor power, or altered consciousness or speech. Berinert can be self-administered if you have been trained and advised to do so by your healthcare provider. Seek immediate medical attention if an HAE attack has progressed to a point where you will be unable to prepare or administer Berinert. Call your doctor right away if swelling is not controlled after use of Berinert. If you self-administer to treat a laryngeal attack, immediately seek medical attention afterward. If you self-administer for an abdominal attack, inform your physician so that other possible causes can be ruled out. Because Berinert is made from human blood, the risk that it may transmit infectious agents, including viruses and, theoretically, the Creutzfeldt-Jakob disease, CJD agent, cannot be completely eliminated. In clinical studies, the most serious adverse reaction reported in subjects who received Berinert was an increased severity of pain associated with HAE. In the placebo-controlled clinical trial, the most common adverse reaction reported more often among subjects who received Berinert than those receiving placebo was dysgeusia, a bad taste in the mouth. Berinert has not been evaluated in pregnant women or nursing mothers. Inform your doctor if you are pregnant or planning to become pregnant, or if you are breastfeeding or planning to breastfeed. The safety and effectiveness of Berinert have not been established in children under 12 or adults over 65 years of age. Please see full prescribing information, including patient product information, available in your self-administration training kit or on berinert.com. Your doctor has decided that you may administer Berinert C1 inhibitor concentrate on your own or with help from a family member or other caregiver. This video will help you learn the proper way to reconstitute and self-administer Berinert. It's important that you or your caregiver learn how to properly administer Berinert before actually doing so. Please do not attempt to self-administer until you've been properly trained by your doctor or nurse. Also, carefully follow the instructions for properly storing Berinert. You can find them in the package insert. Your doctor will talk to you about how to recognize the initial signs of an acute attack and when you should infuse Berinert. He or she will also tell you the proper dose to infuse. You may have to infuse several vials, depending on the dose you've been prescribed. When self-infusing Berinert, it's important that you seek immediate medical help in any of the following instances. If you are unable to enter a vein, if you experience any adverse reactions, or if the medicine doesn't effectively relieve your symptoms. Call your doctor or immediately go to the emergency room if any of these situations occur. Ensure that you fully understand the importance of not starting self-administration of Berinert if the HAE attack, regardless of type, has progressed to a point that you would be unable to successfully complete the self-administration process. Always work on a firm, even, and clean surface. Set out all the supplies needed. This is best done on a flat surface with your Berinert self-administration mat. These supplies include the Berinert vial with the green cap, the diluent vial with the blue cap, which contains sterile water, the Mix-2 vial transfer kit, alcohol wipes, gloves, if recommended by your doctor, butterfly catheter intravenous infusion set, a sterile syringe, a tourniquet, sterile gauze and tape or transparent dressing, a bandage, a sharps container, and your therapy journal. Inspect the Berinert and sterile water vials and make sure they are at room temperature. Do not use the vials if their protective caps are missing or their expiration dates on the labels have passed. Thoroughly wash and dry your hands. Put on the gloves if you've been told to wear them while preparing your infusion. Thoroughly clean your matte and flat surface using one or more of the alcohol wipes. Remove the blister lid from the mix-to vial transfer set. Remove the flip cap from the water vial and clean the rubber stopper with an unused alcohol wipe. Allow the stopper to dry for 30 seconds before puncturing. Place the water vial on a flat, hard surface and hold the vial tightly. Grip the mix-to vial transfer set together with the clear package and snap the blue end of the mix-to vial transfer set straight down onto the water vial rubber stopper. The blue end locks onto the water vial. It's easy to remember. Blue for water. Carefully remove the clear package from the mix-to vial transfer set. Make sure that you pull up only the clear package and not the mix-to vial transfer set. Remove the flip cap from the Berinert vial and clean the rubber stopper with an alcohol wipe. Allow the stopper to dry for 30 seconds. With the Berinert vial placed firmly on a hard, flat surface, invert the water vial with the mix-to vial transfer set attached and snap the transparent adapter straight down onto the Berinert vial stopper. The transparent end locks onto the product vial. The water will automatically pour into the Berinert vial. With the water and Berinert vials still attached to the mix-to vial transfer set, gently swirl the Berinert vial to ensure that the powder is fully dissolved. Do not shake the vial. Just make sure the powder dissolves completely. Now it's time to disconnect the vials. With one hand, grasp the clear side of the mix-to vial transfer set and with the other hand, grasp the blue side of the mix-to vial transfer set. Unscrew the set into 2 pieces. Carefully inspect the reconstituted solution in the Berinert vial. It should be colorless, clear, and free from visible particles. Do not use a liquid if it looks cloudy, contains particles, or has changed color, or if the expiration date on the label has passed. Pull back the plunger to draw air into an empty, sterile syringe. While the Berinert vial is upright, screw the syringe to the mix-to vial transfer set. Now press the plunger to inject air into the Berinert vial. While keeping the syringe plunger pressed, turn the system upside down and pull the plunger back slowly to draw the liquid into the syringe. Then, detach the syringe from the white end of the mix-to vial without touching the tip. If your dose requires additional vials, repeat the constitution steps using a new mix-to vial transfer set for each additional vial of Berinert that you need to reconstitute. Now it's time to prime or fill the infusion set. Connect the syringe filled with Berinert to the infusion set tubing, as instructed by your healthcare provider. Make sure the butterfly clamp is open before gently pushing on the syringe plunger to fill the tubing with Berinert. Apply a tourniquet above the infusion site. Then, thoroughly clean your skin with an alcohol wipe. Begin at the center and work outward in a circular motion. Allow the site to dry before proceeding. Now it's time to insert the needle as instructed by your healthcare provider. First, remove the needle sheath. Next, hold both wings of the butterfly between your thumb and index finger, with the slanted opening of the butterfly needle pointing upward. Insert the butterfly needle of the infusion set tubing into your vein. Insert as flat to your injection site as possible. Use sterile gauze and tape or transparent dressing to hold the needle in place. Make sure the needle is in a vein by gently pulling back on the syringe plunger and checking to see if blood is drawn into the tubing. If blood is present, the needle is in a vein. If there is no blood present, remove the needle and start the infusion process again using a new needle new administration tubing, and a different injection site. Remove the tourniquet and inject the Berinert solution slowly, at a rate of approximately 4 milliliters per minute. If you have to infuse more than one vial, attach the next prepared syringe with Berinert to the butterfly and follow the same steps. If problems such as pain and/or swelling occur during the injection, stop the injection and restart the infusion process in another vein, using a new butterfly needle and new administration tubing. After all of the Berinert has been infused, withdraw the butterfly needle along the line that it was inserted. When the butterfly has been removed, cover the infusion site with a bandage, holding pressure on the site for a few minutes to stop any bleeding. Next, dispose of all the unused Berinert, empty vials, used needles, and the syringe in a sharps container. Record the details of your infusion in your Berinert therapy journal. Write down the lot number from the Berinert vial label, the date and time of your infusion, and any other important details. Be sure to tell your doctor about any problems you may have had during or after your infusions. And bring your therapy journal to each appointment, as your doctor may want to see it. You have now seen the entire self-infusion process properly demonstrated. This video will help you to be ready to take action at the first sign of an HAE attack. If you have questions not answered by this video, please contact your doctor.